there is a growing list of infections that are becoming harder and in some cases impossible to treat. For example, there are an estimated 480,000 individuals worldwide suffering from drug-resistant strains of tuberculosis. In addition, earlier this year it was reported that there were 3 cases of gonorrhea completely untreatable by all known antibiotics. The CDC have reported that in the US alone, there are an estimated 23,000 mortalities each year from antibiotic-resistant infections. The WHO stated that without urgent action, we're heading for a post-antibiotic era, in which minor infections and common injuries, which have been treatable for decades, will once again become fatal. The issue of tackling antimicrobial resistance is complex and widespread. First and foremost, resistance is accelerated by overuse and misuse of antibiotics, in addition to poor infection prevention and control measures. A comprehensive and collaborative approach to this problem will be required, and therefore there are several levels on which action needs to be taken. As an individual, WHO recommended measures include never sharing your antibiotics and always following your healthcare worker's advice regarding prescriptions, particularly after a recent debate postulating that completing the course may actually promote resistance. As a healthcare provider, the WHO advises that you make efforts to only prescribe antibiotics when necessary. 2016 data estimated that in the US, 30% of antibiotics were prescribed unnecessarily, and the aim here is to decrease misuse as well as reducing usage more generally. WHO also advocates that healthcare workers communicate with their patients about how to correctly take antibiotics and how to prevent infections. Action will also be required on a policy level, including implementation of national action plans, surveillance of resistant infections, and advocacy of infection prevention and control measures. In May 2017, G20 leaders signed a declaration on global health which included antimicrobial resistance, and this was considered a positive step by many. There are also areas such as the agricultural sector which will need to take action to decrease antibiotic misuse and usage via both policy and practice changes. A collaborative approach has seen positive results so far. Both the UK's NHS and the US's CDC have reported decreasing antibiotic prescriptions. However, there's still much more that needs to be done. Research must also continue into developing new antibiotics. A WHO report recently raised concerns over the lack of new drugs in the current development pipeline, stating that of the 51 it reported, only 8 were truly innovative. Other strategies may also be important. For example, there may be potential in vaccinating against some resistant bacteria. Research is also ongoing into alternatives to traditional antibiotics, such as employing predatory bacteria or bacteriophages to target resistant infections, with some promise thus far. Interested in learning more? As part of our focus this month, we've produced a short series of opinion pieces on these alternatives, and you can view these via our World Antibiotic Awareness Week homepage linked below. Finally, be sure to follow us on both Facebook and Twitter for further infectious disease updates.